today's meeting today, and we'll share the slides along with a link to the recorded session following today's webinar. Again, we have a lot of folks who are joining us, so we are going to be muting all lines. So if you've dialed in using your mobile device, you may want to wait until the end of the presentation. I can unmute all the lines if we need to, and folks can ask your questions directly to our presenter. Jamie Pena, are you with us today?
I'm here. Sorry, I had to find the right box to unmute.
Great, Jamie. We can hear you just fine. I'm going to turn the presentation over to you.
All right, perfect. Thanks so much, Christine. And as Christine mentioned, I'm Jamie Pena, Director of Recruitment and Engagement here at Health Current, a Contexture organization. We are Arizona's Health Information Exchange. I'm going to get started. I do just want to mention to the group that we had a few join by phone last time, and you know, when you join by phone, you're unfortunately unable to see the webinar. So we will record and we can send out the slides at a later point in time if you're unable to join us via the actual WebEx URL. But other than that, we'll go ahead and get started. So our agenda for today includes an introduction to Health Current, again, a Contexture organization, an overview of our AZHIE benefits and services, an alert overview, and then a live AZHIE 3.0 portal and demonstration. We'll also review some programs that you can participate as part of Health Current, and then leave some time for questions and answers. Feel free to enter those questions as we go, and certainly if there's an opportunity to pause or when we get to the end of the presentation, we can answer those questions then as well. Just a little bit about Health Current and who we are. So we are the Health Information Exchange that helps partners transform care by bringing together communities and information across Arizona. Our vision is to make healthcare transformation a reality. So some background information around Health Current. We were founded in 2007. This was part of an executive order here in Arizona. We also have services including Arizona's Advanced Directives Registry and the SDOH referral system. We recently joined forces with Colorado, the COREO, in 2021 to form a regional organization now titled Contexture. So these are just the types of participants that can participate in the AZHIE to your right there. And just to give you a little background around COREO and what they bring to the table as well, they were founded in 2010. And they provide AZHIE services and healthcare quality improvement services throughout the Front Range in rural Colorado. We joined forces, as I mentioned, in 2021, and there's just some information here as how many unique patients are in that AZHIE system, as well as the number of providers. So you can see their population is significantly covered in that diagram. So we are a new brand, but we are the same commitment to your organization as well. So you'll start to see us switch away from the Health Current standard branding over into our Contexture branding. It has such a nice upbeat feel with the colors that really pop now. All right, so let's get into who is participating with Health Current today. We have over 985 AZHIE participants, and I actually checked just a few moments ago, and we are so close to hitting 1,000. That means that you have a wealth of information at your fingertips when it comes to clinical information for your patients. We have over 200 data sources currently sending patient medical records to the AZHIE, and that is data that's available on over 12 million unique individuals. So now we're going to go into the AZHIE benefits and services. So what are the benefits of the AZHIE? First one being one connection to save time and resources. The idea of having patient clinical information in a consolidated platform so that way you can go in and access that information when and where you need it, and not have to look to multiple medical records, departments, or portals, faxes to obtain that information. So you can access patient information when you need to. And you'll have access to timely information to coordinate care. So this is really helpful for our case managers and the data care planning teams to to make sure that they have that information at their fingertips. It also allows for secure communication utilizing HIE's Direct Trust Certified HIPAA compliant secure email system. Some EHR platforms already have secure communication, so that's fine. We can use that as well. If not, you would be able to get an assigned Direct Trust Certified email from Health Current. Additional benefits of the HIE include support for value-based contracting, helping you to exceed your value-based measures, population health. We're able to provide alerts, and we'll get into the details around that. But specifically for your population categories, high risk, chronic illness, and frequent ED use. We are also able to support care management by giving patient panels assigned to specific care management staff that will receive an alert anytime a patient has had an event triggered in the HIE. And this also allows to have immediate clinical interventions for these patients as well. This diagram just shows you a little bit about how the HIE works in terms of it being a central repository. So you have the HIE above here, and then all of the different healthcare providers. So essentially that information can go back and forth from any of the healthcare providers that are sending data to us, and then the HIE sending information back to them as well. So just showing the free flow essentially of clinical information between participant and the HIE. We're going to hop over into our HIE services here. So Health Current offers a range of HIE services. These include portal, alerts, direct secure mail, data exchange, clinical summary. Core HIE components contain master patient index, integration engine, and the clinical data repository. All right, so HIE 3.0 portal. The portal is a secure way to access consolidated patient record information. This includes SMI patient crisis data. So it also includes all treating physical care providers and can include behavioral health services. So this goes back to our 200 plus data providers. You're able to go into the portal, access a patient one at a time using last name, date of birth, and then anything that we have related to that patient will be in that one consolidated record for you. This is used often by care managers and clinicians for a complete patient history, as well as to conduct population health activities, and we can do that up to 36-month periods. Some of the data you can expect to see in the HIE includes patient demographic information, lab results, radiology reports, transcription notes, encounter summaries, discharge summaries, and then you can always download a clinical document, CCD, or a patient summary, which includes all of the information for that patient. And again, here are some additional data types that you can see, as well as the social determinants of health and the Arizona Healthcare Directives Registry links. So those are two new lines of service that we have begun offering in the last year or so. And so certainly feel free to join us for one of the events or one of the road shows that we have for those programs to learn more on them. So data providers and data types. We always try to direct people back to our website. We do have a comprehensive list of data providers and the data types that they are submitting to the HIE. We have primary care and specialty providers that submit data to us, as well as the inpatient settings throughout the state. EMS agencies, several of them are now participating as well. So again, that comprehensive list is on our website. It's always kind of good to see if your referral network is already a participant. And this is just a brief screenshot of what the portal looks like. And we're actually going to go into the portal demonstration here in just a moment. But you will see that the portal is broken out by clinical sections. And then this is an HIE testimonial from one of our current participants, stating that they use the HIE as a huge part of their daily work. So they're able to prepare for each appointment by looking at the patient's information through the portal. So this way they have that information before a patient ever even walks in. All right, with that, I am going to go ahead and move into our portal demonstration here. I'm just gonna go back to our search so that you guys can see how we do this. So you'll use the search icon in the upper left-hand corner, And then you'll be able to enter the patient's last name. You can enter their first name. And then date of birth is required as well when you're not in a training environment. And then there's a search reason list below. So I'm going to go ahead and say that this is for treatment. You'd want to choose the applicable reason for your organization. And once you search for that patient record, any potential matches for that patient will come up in a list form. You can also pin that patient to your work group. What that does is if it's a patient that is high risk and you're monitoring on a frequent basis, or perhaps is a frequent ED user, you would have access to that record much quicker because you already have them pinned to your work group versus having to look them up each time by demographic information. So go ahead and click on the patient name. That'll take us to the patient record. And then, as I mentioned, we do have the clinical cards set up here. So we have an encounter section, we have allergies, we have lab results, radiology reports, imaging, medications. Each one of these clinical cards indicates how many reports and or results are in each of the sections with a number in parentheses there. So for this one, we have a few that are indicated as other. This one I think is an imaging report. So we don't have images themselves, but the imaging report is available. And so you can see that information here. And you can always print this if you wanted to, or you can save it so that way you can make it part of your own EHR. That's completely up to you. Or if simply reading it here is enough, you can do that also. Then if I go over into the lab results section on the right-hand side, you can see that there are some indicators when a patient has a lab value that's within or that is not within a normal range here. So we can see that this one is below range. And if you hover over the icon, there is a legend for you to look at as well. You can click on that to go into further detail. And it'll give you that full lab panel. And then, as I mentioned, we also have medications, we have conditions, vitals, external documents. This is where you're going to find your patient encounter summaries. These can be from primary cares, these can be from inpatient settings as well. And then you can check the box for which ones you want to look at, and then you can simply hit view, or you can hit download as well. But an encounter summary, it's also going to include your review of systems, any medications, vitals, results, procedures, vaccines, and then just the physical exam itself. So this is also really helpful. We have organizations that utilize this for prior auth for insurance approvals. So it's another way that the AZHIE can be of benefit and make your workflow just that much more efficient. Okay. And then another option is to, if we go over here into the actions section of the patient record, would be to subscribe for patient notifications. We haven't quite gotten into alerts just yet, but that ultimately is what will provide an alert for that patient. And then also you can add them to a patient group, or you can download a document. So if I wanted to download a document for this patient, you can choose to do that in either a PDF format or a CCDA. A PDF is essentially a human readable format. And then a CCDA is machine readable, meaning that you could essentially import this into your EHR and have it become structured data. So for right now, we'll say PDF. You can choose if you want to just have the summary, or if you want to have a detailed level. You can choose a certain date range, and you can also choose to include clinical items with or without dates. So once you've chosen all of your different selections, you can say generate that report. It will come over here on the left-hand side saying that it's generating, and then when it becomes available, it will also display another notification. In the essence of time, I went ahead and downloaded that encounter summary already. Note that depending on the patient record and how much information is in the AZHIE will determine how long it takes for an encounter summary to populate, as well as the date ranges selected. So because I didn't put in date ranges, the record's going to be more comprehensive and may take longer to load. But again, so we can see here, this is the patient summary. This includes everything we have for that patient. Okay. Then I'm going to go ahead And I'm going to switch back to our presentation. Should be all set there. And we'll start going into some of our alerts. And so we went into portal, and that's a manual process in that you can go in and you can access that patient information. It's still much more efficient than having to access multiple portals and or calling multiple medical records departments. But the alerts is where we kind of get into this a little bit more automated piece. So patient alerts are event-driven notifications, and they're triggered by admit, discharge, registrations, and clinical laboratory results. So essentially, a notification happens that identifies an event for a predefined population. So this could be high needs patients, it could be chronic care panels, SMI. These can also be condition-specific panels. These are used by care managers and case managers and clinicians for monitoring the care and follow-up for the patients. The different alert types that we have available, as mentioned, can include admit, discharge, and transfer, COVID-19 test results, clinical lab results, transcriptions, radiology reports. These can be delivered in both real time or batch. And we're gonna go into that here in a second. So when are alerts received? Again, these can be done real time or batch. So real time means as soon as an event is triggered. So what we would do is we would work with your organization to extract a patient panel, and we would upload that to our system that essentially will tell us in real time, anytime your patient has one of those events triggered. So again, an admit to an inpatient setting, an abnormal lab value. And then at that point, the individual who receives those alerts in your organization would be able to identify what patients need follow-up and how to respond. And this is kind of good for managing smaller groups, the high-risk patients. Now, in terms of monitoring your entire patient population, it's going to be more beneficial to do that with your batch alerts. The batch alerts allow you to receive an aggregate report of all the patients that have had some event triggered in the HIE. And so this can also be used to trend and monitor performance over time with a team or a clinic level. So this one's better positioned for managing larger patient groups. These are a few screenshots of the different ways you can see the real-time alerts. So this upper left-hand corner here is a PDF that was sent to our direct secure mail. And so again, as I mentioned early on in the presentation, if you already have access to a direct secure mail, we can route alerts through it. There's not a need for you to have a second mailbox set up. If you don't have one, this is also part of our standard implementation. Now, other formats you see here are raw HL7 sent to SFTP server on a VPN. And so that's another way that we can do that if you want to receive it directly. CDA sent to direct secure mail. Again, we can send that to you through the direct secure mail with the attachment, and then a raw HL7 sent with XML. So all of these are options and different ways that you can receive the real-time alerts that will display differently depending on how you have these implemented. So here is an example of our batch alerts. There are 3 different options. One, our standard report, and these can be done usually daily or weekly. Okay, and then the second option is to have the original patient class value, event type, and visit number. So on this one, you don't have the event. We have the visit type, but it doesn't include it in the class values like it does here. So this is more structured data. Oops. And then the third option is the same as the second, but includes the patient's address and phone number. And this is an example of a batch alert that's in a PDF version. So we would have essentially, it's segmented by the organization that is sending us the information, and it would include a comprehensive list of any patients. So for example, any patients that were admitted to Banner University Medical Center would be present in this alert. So a couple of things to just think about as you think about how you might work alerts into your own workflow and how to make that more efficient. think about populations related to your value-based programs, your accountable care organizations, Medicare quality measures, your chronic patient care, diabetes, COPD, your high needs individuals, frequent ED users, crisis risks, active patients, and pain contracts. So these are all the different areas that we can focus on as part of your implementation and making sure that you get alerts to be most efficient for you. Additional types of alerts include EMS alerts. So one of the things that we're working on with EMS agencies is they submit their patient run charts to AZHIE peers, which then is connected to the AZHIE, and we are able to have a copy of that patient run chart inside the AZHIE, which can also trigger an alert to a practice, as well as we can actually return the discharge summary from the hospital back to the EMS agency. So this starts to help close that loop on the patient outcomes. It allows an agency to monitor what outcomes are, as well as for EMS agencies who are currently running a treat and refer program. This allows them to assist with that program as well. Other alerts include psychiatric hospital alerts, an ADT event notification from an approved inpatient behavioral health hospital, and based on patient panels uploaded to the AZHIE, they can be sent real time or batch. And then COVID-19 immunization alerts, so we can alert, and then, as well as the lab result tests for COVID-19. And then I think this is the last one in terms of alerts go. This is related to patient-centered data home. We are part of a strategic health information exchange collaborative, also known as SHIEC. And so essentially what this does is it allows HIEs across the country to connect to one another. And so by doing so, if we have a patient that is an Arizona resident that is treated in a location that is connected to an HIE throughout the country and is part of this program, when they register with an Arizona zip code, it automatically triggers our HIE to be able to pull that information from the other participating HIE into our system. So for example, if we had an organization that, or if we had a patient that went to Colorado, was treated in Colorado, and they registered with an Arizona zip code, our HIE would trigger our HIE to pull that information in from Colorado. So by participating in this program, it also allows us to have almost 90% of the US population in this national collaborative. So real quick, I just want to share with you a success story from Horizon Health and Wellness. Horizon Health and Wellness utilizes our alerts. They identified 30 of their top ED utilizers and designated a person to receive and disseminate alerts to care managers. They developed an education pamphlet for patients when it's okay to go to the ED, concentrated on their seriously mentally ill patients, extending the hours that they saw them and adding in walk-in services. By receiving the alerts from the HIE, they were essentially able to focus on those top utilizers and saw the average number of visits for the hospital go from 3.1 to 1.5 visits per month. So they're also able to reduce unnecessary tests and procedures by searching the HIE prior to completing those tests and procedures. And then additional HIE services includes EHR integration. I don't go into a huge level of detail on EHR integration, typically because every EHR that we work with is so vastly different. We are able to connect to most, depending on what they are technically capable of, but in having that integration, it allows us to send and receive information for the healthcare community. So one of the best parts about our services is that they are free to community providers. And what is a community provider? Essentially anyone that is not a health plan or a hospital. So certainly all of the services that we discussed today would be available to you at no cost. I'm going to take a few minutes just to go into the programs that are supported by Arizona's HIE. The first one I want to go into has been a very hot topic here at Health Current. It's the differential adjusted payment program by Access. And so essentially what it does is it allows access to distinguished providers that have committed to supporting patients' care experience, improve members' health, and reduce cost of care growth by participating in the HIE. So we're going to the goal of that program is to essentially increase efficiency and improve care quality by connecting to the AZHIE. We do have some newly eligible provider types for DAP CYE 2023. Those include OBGYN, cardiology, pediatric, and nephrology physicians, MD, DOs, PAs, and nurse practitioners, and then assisted living centers, so provider type 49. So this is just a quick snippet of the different percentage increases based on eligible provider types. And so, as mentioned, though, the newly eligible provider types, this is the first year that they'll have an AZHIE requirement as part of DAP. So certainly want to get you signed up and joined early so that we can get you on the right track and make sure that you're eligible for those increased access reimbursement rates. This is the LOI and SDOH submission process. So SDOH, as I mentioned, is one of the service lines that we offer now as part of Health Current. And so that has also been embedded into the DAP program. So the first thing that we'll want to do is for any eligible provider type, they'll want to sign a letter of intent, and they'll want to return that back to Health Current. And those instructions are on this slide as well as on our website. So the LOI, and then also if you're planning on participating in the social determinants of health program, you'll want to submit a registration form and the registration letter. So all of these details can be found on our Health Current website. The LOI must be submitted by April 1st, 2022. So if you are joining this call and you are already a participant of the AZHIE, please reach out to your account manager and see what needs to be done prior to April 1st. But the first step is always the LOI. And this is just kind of an overview of where the AZHIE milestones are headed for the upcoming year. This you can actually find in the preliminary notice that was released by Access. So this is available to the public. And notice that for CYE 2023, that's where we have nursing facilities, assisted living centers, provider type 49, and then physicians and PAs that will all have an AZHIE requirement of data access. And then just a couple of other dates to highlight for the differential adjusted payment program is the preliminary notice is released on January 28th, 2022. So that occurred a couple of weeks ago. There has already been a revised version as of February 10th, I believe. So if you downloaded the first one, you may want to go back and download the second version. Contexture will be holding DAP webinars in March. I think it's the second and third week. Those events are already posted on our website, so feel free to go in and register for them. And then after that, the webinars, you'll know a little bit more about which LOIs that you need to submit, especially if this is the first time that you've had an AZHIE requirement for DAP. And then you'll want to get those in by April 1st. So, and then we're going to include the slide deck to everyone, and you'll have the links to the preliminary notice and then the AZHIE requirements as well. All right, the last program I just want to touch on is the Health Current C3 support services. This is a piece that is required by hospitals essentially for CMS conditions of participation. What they have to do is they have to demonstrate that they have sent minimum patient information, including patient name, practitioner name, and sending institution name. They have to send patient event notifications. So similarly, when we talked about alerts coming from an inpatient setting through the AZHIE to a practice, it's the same concept, but hospitals have to prove that they were able to accomplish this process for CMS. So one of the things that we do is we collaborate with the hospitals to identify the primary care and the specialty providers that they are sending these alerts to, and making sure that the alerts are routed appropriately. So if we have a hospital that comes to us and says that they have alerted to, or they need to alert to, X, Y, and Z organizations, we make sure that they are already participants of the AZHIE. And if they are not, then we actively reach out and recruit those organizations. This is a sample dashboard of our support services that we provide to the hospitals. This essentially just shows you that a hospital had 414,000 messages coming through to the AZHIE, and that represented represented 227,000 treating providers, which puts them at a 55% compliance. So ultimately, the higher we can get that percentage rate, the better. But that's how we will work in conjunction with the hospitals to make sure that we have those treating providers signed up for the HIE so that they can actually receive those alerts, ultimately meeting the compliance for this program. Okay, so if you made it this far, next steps are around how to become a participant. We would love to hear from you. You want to schedule your initial contact with our recruitment department. You can do so by emailing recruitment@healthcurrent.org, which will be on the next slide. You can also fill out an interest form on our website, and it allows you to schedule a meeting directly with us. Once you have that phone call scheduled with us, we'll go through the basics of the HIE with you and determine what kind of services and programs you're eligible for. And we do go through an organizational verification process, which essentially is us reiterating the information you've provided to us and making sure you are a permitted healthcare provider underneath our permitted use policy. Once we have gone through that process, we will have an agreement and an amendment signed to your organization or sent to your organization. Once you have that signed and returned, we will have an HIE account manager assigned, and that HIE account manager will schedule a kickoff meeting, ultimately initiating your services. So we typically say that portal and alerts take anywhere between 4 and 6 weeks, really just depending on the effort of calendar coordination. So here are some email addresses for you to contact us. Again, slide deck will be provided so you can click to schedule your appointment. Otherwise, you can fill out an interest form on the website as well. And I think that's the last slide, but I'm going to leave this one up and we can move into questions.
Thank you so much. Again, the chat box is available to ask questions, or you're welcome to, if you hover over your name, if you're online, and raise your hand, I'm happy to take you off of mute if you'd like to ask your question live to Jamie. And for those that may have popped open the chat box, there is the link to the DAP CYE 2023 program there. As Jamie mentioned, we are kicking off our webinar series in March. You can find out more information about the DAP program and register for webinars using that link. We'll also include that link for everyone along with the slide deck and a recorded presentation today. Give everybody another few minutes in case they're moving. Not seeing any questions come through, Jamie.
Okay. All right. Well, thank you all for attending the presentation and the webinar today, and we look forward to hearing from you. You can, again, reach out to us through the emails that are presented on the screen, or you can reach out to us on the interest form on our website as well. So even if you are an existing participant, we're happy to hear from you and guide on next steps.
Wonderful. Thank you all for participating today. Thank you again, Jamie. And again, we'll hope to see everybody on the connected to the HIE or in one of our great programs. So thank you, everyone. Have a wonderful afternoon.
Thanks, Christine.